Hi, my name is Shaylin. I'm your student nurse today. Can I get your name and date of birth, please?
Sarah Pelisico, May 9th, 1995.
Nice to meet you. So today I'm going to teach you how to take your pulse because your doctor prescribed a beta blocker for you since you have high blood pressure.
Okay.
And what that's going to do is it's going to lower your blood pressure, but it's also going to lower your pulse.
Okay.
By the end of this teaching, you will be able to identify where to take your pulse at.
Okay.
It's going to be your radial pulse.
Okay.
And you are going to be able to identify if it's regular or irregular. And you're going to be able to identify if it's normal. And normal would be between 60 and 100 within the minute.
Okay.
Okay, and I have a couple questions for you. How do you learn better? By doing or by watching?
Watching.
Okay, so I will show you first.
Okay.
So I'm going to take my non-dominant hand and I'm going to lay it down with my palm facing up. And then I'm going to take 2 to 3 fingers, never the thumb because it does have a pulse in it as well.
Okay.
And it's going to be on your thumb side. And probably about an inch down in this little groove right here. And you will feel it pulsating.
Okay.
It's like a throbbing. And then you would count for 30 seconds every time you felt that. And after you got done for your 30 seconds, then you would times it by 2, and that would give you your pulse rate.
Okay.
Since you have high blood pressure, your pulse is typically higher.
Okay.
So if it's above the 100, it's okay for you to take your beta blocker, but if it for some reason is lower than 60, then we're not going to want you to take your beta blocker that day because it's going to lower your pulse too much, and it wouldn't be safe. You could be confused. It could alter your consciousness. But if you've been working out or anything like that before you would take your medicine, just wait 5 to 10 minutes or until you feel like you're calm and your heart's not racing from working out.
Okay.
Then you would take your pulse. So for the sake of this video, so we can do it at the same time, I'm going to just use a timer on my phone so you can get the idea.
Okay.
But you can use a watch or a clock with a seconds hand. Were you able to count your pulse?
Yes.
Could you tell me what you got?
98.
98? Okay, so on a day like this, we would want you to take your beta blocker medicine.
Okay.
And just to make sure that you understand, can you teach me how you would take your radial pulse?
Okay. First, I would lay my hand, and then on my wrist, on my thumb side, I would take my pulse with my index finger and my middle finger, and count for 30 seconds and multiply it by 2. And then if I've been active, I would wait 5 to 10 minutes.
Yes. And just starting out, you can always count for the full minute if you feel like you're not sure, if it's irregular, whatever the case may be.
Okay.
Do you feel confident in going home and taking your own pulse?
Yes.
All right, great. I will still send you home with a pamphlet, and if you
Okay.
have any questions, you can refer to that, or you can always call me or the office and ask to talk to me if you have any questions.
Okay.